Hospital beds in the NHS have never been under more pressure.
It's just unrelenting at the moment.
With more patients to care for than ever before, and only 150,000 beds to go round.
It is a fast-paced job. There's a non-stop conveyor belt.
In this series, we use special cameras on beds in 4 very different hospitals.
Comfy bed.
To see the world through the bed's eyes.
Left at the lights.
As they share the most challenging.
Oh, it's coming again. Oh.
Please don't get upset. I will look after you, okay? Are you okay, Pet?
Most intimate.
Let's go.
And most rewarding moments of our lives.
You get in hospital and you go,
Coming up, in Barnsley, on A&E bed 12, 64-year-old Charles is in severe pain, but worrying about his wife.
It's a bit of a problem because I'm my wife's carer. She is disabled. So being in here is a problem to me.
On resus bed 2, 16-year-old Lewis fears for his footballing future.
I just felt like my arm snapped.
And in Leeds, on Pediatric bed 3, 6-year-old Ruben faces surgery once again.
Just reminds me of when he had his liver transplant to put him to sleep.
Your bed's like an extra member of staff almost.
This is the secret life of the hospital bed. Barnsley Hospital, South Yorkshire.
Did that one go up to Children's Assessment Unit? OK. OK, brilliant, thank you.
There are 40 mobile beds in the A&E department.
Ready, steady, slide.
These beds never rest, seeing over 200 patients a day, from potentially deadly strokes.
I just can't imagine what's happening.
To life-changing injuries.
Can you feel me touching your little fingers?
Yes.
Right.
Bed 12 is about to meet its next patient.
Grab you a gown.
64-year-old grandfather of 3, Charles, has been rushed in with severe pain in his abdomen. Lead consultant Dr. Griffiths is assessing Charles.
What's been happening?
If I inhale too quick, cough, very painful.
Right. And any other healthcare problems that you suffer with?
Diabetes,
Right.
high blood pressure, you name it, I've got it. The pain is in here. If you can imagine putting your hand into a hot frying pan, that's more or less what it's like.
Charles is in hospital alone, but he's worried about his wife of 28 years, Wendy.
It's a bit of a problem because I'm my wife's carer. She's disabled. So being in here is a problem to me.
Have you had any operations on your tummy before?
I mean, I was a child, appendix.
Right.
Dr. Griffiths is concerned Charles may have a potentially life-threatening bowel blockage.
You might have a condition that's known as bowel obstruction, and sometimes when that happens you can get peritonitis, which is where either you get a small hole in the bowel, it perforates, and that needs an urgent operation. So your tummy looks a bit swollen. Is it normally swollen?
I am a human camel.
Peritonitis is potentially fatal because you can easily develop abdominal sepsis, which is really difficult to treat because it's within the abdomen. Is it sore when I press up here where you've been getting the pain? Sepsis can develop into multi-organ failure. So we need to get some x-rays to rule that out and speak to the surgical team and get them to come and have a look at him.
If the x-ray shows a serious bowel obstruction, Charles may need an operation.
Worst case scenario, if there is anything that needs to be chopped out,
Yeah.
how long is it going to take?
It can be quite a big operation, having your tummy cut open and things removed, so that you're looking at quite a lengthy sort of post-op stay to recover from the surgery.
It's only my wife, obviously.
Oh, yeah, no, I understand.
I mean, eventually I'll be able to phone
Yeah,
Wendy
absolutely.
and sort her out. You know?
Yeah. Let me just get some things organised, Mr. Hewitt. All right, be right back.
Charles?
It is indeed.
Right, take for an X-ray.
Yeah.
We're on this road.
Right.
A&E bed 12 takes Charles to X-ray. He's been away from his disabled wife Wendy for nearly 3 hours now.
I don't mind staying in and being operated on, whatever. But he did say it's a long post-op period, you know. Which has got me... I'm not that bothered about Wendy not being looked after, because I know she will be. I'm just bothered that it's not me that's looking after him.
Later, we'll find out if Charles does have a life-threatening bowel obstruction and whether he'll need an operation. Leeds Children's Hospital.
Don't tell you what I said, but I said you're my favourite now.
The busy day surgery unit here has 26 beds, treating over 500 children a month.
Yes, you did.
These beds work under stressful conditions. They're with children and parents before
To do it. Do you want
and after surgery.
You see how comfy beds?
Yeah, beds are the main thing in a hospital, because if you've not got a bed, you cannot have the operation.
Oh, sweetheart, I love you.
Pediatric bed 3 is ready and waiting for its next patient. 4-year-old Ruben is here with parents Beth and Mark.
There you go.
Oh, wow, look
Got
at
for a
that.
special bed. Yeah? Whoa, there you go.
If anyone's talking, you are talking there.
Right.
Yeah, it's
Is that
okay.
you all nice and comfy?
Caring for him today is Sister Ferguson.
So why are you here today, Ruben? What have you come to see us for? You're doing what?
You banged your teeth,
You
didn't
banged your teeth?
Ruben has come in for extensive dental surgery. As well as damaging his front tooth, Ruben has decay and staining caused by liver disease.
They're taking that top tooth out and they may take some out at the back, and they are capping some because of his medication. They've all got holes in, and then they're putting a white coating over his teeth because people at school have started to notice now that his teeth are yellow stained.
Ruben is used to spending time in hospital.
So what have you been here for before? Because I know you've done all this before.
What did you have?
What do we say? People don't push you in your belly because you've had
Liver transplant.
good
Liver
boy.
Right. Wow.
How long was we in hospital?
What can you?
For
10 years.
6 months, weren't we?
6 months, a very long time.
Every year, around 100 children in the UK have life-saving liver transplants. The reason for Ruben's was particularly rare.
The surgeon had said it's biliary and it happens to one baby every 4 years in Great Britain. rare Ruben, aren't you? Hey?
Ruben will need medication for the rest of his life, but it doesn't hold him back.
What are you doing to poor Mickey down? Oh, that's not nice. Poor
Mickey
Mickey.
Mouse.
WWF, maybe.
Yeah.
He's definitely not backwards at coming forwards, is he?
Ruben, what's Nurse's head?
He's a bit of a live wire. He's definitely got plenty of energy, and I think if there was any kind of advert for transplant services, then I think he's your guy.
Two hours after arriving, it's time for Ruben to have his extensive dental surgery.
The quicker we go, then you can have something to eat.
Oh, yeah.
Good boy.
Leaving bed 3 behind, the family head to theatre.
When you wake up, I'm here. What? Eh?
Right, do you want to give Mummy a big kiss?
Give Mummy a kiss and a cuddle.
Oh, you ready?
That's it.
Ooh, okay.
See you, Pete.
All right.
Right.
You go,
All
all
right,
right?
don't cry.
You
Get ready for the wind.
Whoa!
I'll see you when you wake up.
See? Okay, aren't we?
Really teary. Every time, all the time. Even Johnny having some tea out. Just reminds me of when, well, we both went in with him when he had his liver transplant to put him to sleep. It always reminds me of you, even when you're walking by intensive care, the one that he was in. You do what you're being, innit?
Later, we'll rejoin Ruben as he's put to sleep on surgical bed 4.
Really well. You've done so well. I take it.
Never gets easier.
Oh. Oh no. Got you.
Back in Barnsley in South Yorkshire. Here, the A&E department has 5 specialist resus beds,
Fine, I think we'll see you in resus. We've got beds in there.
reserved for patients who need close monitoring.
All emergency departments will have a resuscitation room of varying size, and that's where we see the most critically ill and injured patients. Things like sepsis, strokes, heart attacks, major trauma.
Today, resus bed 2 is transporting 16-year-old Lewis into the resuscitation room.
Right, Lewis, let's get you in here. Now, if you want to.
The aspiring young footballer has dislocated his elbow during trials at Championship club Barnsley FC.
Have you got any tingling in your fingers?
No.
With him is Dad Brian.
And can you lift your thumb up? Good. And this one? Perfect. Right.
In his second match, he's fallen back on his arm and he's been kicked in the elbow, which is dislocated.
It just felt like my arm snapped.
That's it. It's a heart-wrenching to see your own child get hurt.
Consultant Dr. Humphrey is on shift.
So, do you play for Barnsley Academy or something?
No, I was just trying.
You're trying out for them?
Yeah.
So have you just...
Well, yeah. Well, he went to Leeds yesterday and they taken his details. So.
All right, okay, so you're sort of shopping around for a contract, are you?
It is a worrying time. He's got other trials coming up, so he has to get himself back fit.
The elbow is one of the most common joints dislocated in children. Sport injuries cause around half of them.
You've got to put a lot of force through your elbow to dislocate it. So as you can see on the x-ray, his joint, it's popped out the back. This cup here should be over here. And to put that back in, what you have to do is basically make him nice and relaxed, take the pain away, and allow all the muscles to relax to enable me just to gently push it back into place without doing any further damage.
Without painkiller, this procedure would be agonising. Lewis will be given a high dose of sedative.
Relax. Okay, this is where you need to relax, all right? You do realise this will be your match of the day when you're playing for... goodness knows who. Hey? No, he's going to play for Spurs, I've decided. A budding young professional footballer, then the main issue for me is actually making sure we get his elbow back into the right position and avoid any nerve damage which may cause paralysis of the hand or the fingers, which would obviously affect his future career.
We'll return to Lewis and resus bed 2 later as Dr. Humphrey tries to put his dislocated elbow back into place. Leicester's Royal Infirmary. Here, the maternity unit's 16 beds deliver over 100 babies a week.
Well done, you did really well.
Mummy's here. It's okay, baby.
Recently, though, these beds have seen even more births than usual.
It's about 42 weeks now that Leicester won the Premiership League.
As a result, we've had a nice big baby boom.
Yeah, because when people are happy, they celebrate.
Maternity bed 5 is ready for 41-year-old Gillian.
You can take a seat there, or in the chair, or in the bed.
Yeah, you love the bed, yeah.
Husband Matt is with her.
Assume your natural pose, which is generally lying down.
Yeah.
Our journey started sometime around the 2nd or 3rd week of May. Actually, the village itself was in very high spirits, and probably we were too,
Must
to be
have
fair.
been,
Gillian is 3 days overdue. She's come in today for an induction to move her into labour.
So nice to have a bed beside the window. So remember when we had Danny, it was really warm.
Let me have a little look at your veins, sweetie. Do you want to sit in the chair?
Midwife Robinson is on the day shift.
So I'm going to pop a cannula in you so I can just take your bloods and everything.
Gillian and Matt met 7 years ago. 18 months later, Gillian had her first baby, but she needed an emergency caesarean section. This time, she's hoping to have a natural birth.
There is definitely a part of me that wants to bring this child into the world myself. It's kind of strange to hand over that responsibility to a surgeon.
In the UK, 1 in 5 labours have to be induced like Gillian's.
Okay.
You're doing well.
I'm not doing too badly,
You're
I think.
doing really well. I'm really proud of you.
Thanks.
More than 12 hours have passed since Gillian was induced. Midwife Wells has taken over her care.
Okay, all done, darling. Okay. The best thing that you can do at the moment would be walk round.
Okay.
Getting on the ball, opening out your pelvis.
Okay.
Getting baby's head right down onto that cervix.
Okay.
Let me lift the head of the bed up for you, darling.
Gillian's progress towards a natural birth isn't going to plan.
Our induction is maybe a little bit slower than they'd like. Once I get off the bed and finish with this round of monitoring, it's up and down the stairs, bounce on our ball, do everything I can to try and move things along a little bit further.
Later, we'll return to Gillian to find out if she can experience her dream birth. Coming up on The Secret Life of the Hospital Bed. On A&E Bed 12, doctors are concerned for 64-year-old Charles's health.
Any family history of bowel cancer or anything?
Grandmother, uncle, mother, brother.
On Resus Bed 2, 16-year-old Lewis is praying his dislocated elbow won't ruin his footballing hopes.
I hope to get back to it as soon as possible.
And in Leeds, on surgical bed 4, 6-year-old Ruben faces surgery once again.
He's done well. He's a fighter.
Back at Barnsley Hospital, A&E Bed 12 is taking 64-year-old Charles for x-rays.
Hold your breath. Breathe away.
Doctors fear he might have a potentially life-threatening blockage in his bowels.
Pop that side up so you don't go anywhere. You alright? Do you want to lay back down?
If Charles has a blockage, he'll need to stay in hospital for an operation. He's worried about being away from his disabled wife, who he's been caring for 12 years.
She became ill in Calais in Spain, and she's got a problem with her back. She can't walk any further than that door to that curtain. You know, we use a wheelchair for going shopping and stuff like that.
Charles's x-rays are back. They show no signs of a bowel blockage, but tests ordered by Dr. Griffiths show his white blood cell count is sky high, which can sometimes be a sign of cancer.
Some of his blood tests have come back. He's got a problem with his kidneys and his inflammatory markers are up as well. So there's clearly something going on. Hello again.
Hi.
Just a quick update. Your x-rays look fine. I can't see any obvious evidence of, sort of peritonitis or something that's burst in your tummy. There's clearly something going on and you make you feel unwell. So we're going to get you up to the surgical ward in a little while, and the surgical team will obviously carry on your care. So as soon as they're ready for you, we'll get you upstairs, Mr. Hewitt.
Okay,
All right.
thank you.
Hello there.
Hello.
Specialist doctors, Mr. Alamin and Dr. Kelly, come to talk to Charles to get some family history.
We're from the surgical department. Well, you're going to have a problem with your abdomen, is that right?
Any family history of bowel cancer or anything?
I don't know if it was bowel cancer, but grandmother, uncle, mother, brother, she. And they've all gone with cancer.
You're not sure what cancer is it?
I don't know. I think
Okay.
the grandmother was definitely bowel cancer.
Charles needs to be admitted for further tests to get to the bottom of his concerning blood test results.
I know it's for my own good. And the sooner I can get better, the sooner I can get back to looking after Wendy.
A&E bed 12 takes Charles to the surgical ward. It's then free to return to A&E to wait for its next patient. Back at Leeds Children's Hospital, 6-year-old Ruben is on surgical bed 4. He's about to be put to sleep.
You okay, mate? You're a brave boy, aren't you? You okay? You okay, mate? Yeah? You okay? Yeah, baby. See you, mate. See you later, mate. Good boy.
Boy, honey. Thanks, guys.
Ruben had a liver transplant at the age of 1. His liver problems and treatment have led to tooth decay. Consultant dental surgeon Mrs. O'Sullivan will be performing the operation.
Ruben's got some decayed baby teeth and he's got some teeth that haven't developed very well because of his liver problems, so we're going to make them look nicer for him so he can have a nice smile. The original liver disorder that he had, some of the products that go through your liver then get into the dentin of the tooth and cause quite a lot of staining underneath, so it makes the teeth look quite brown.
While Ruben's in theatre, his parents, Beth and Mark, wait by Pediatric bed 3. The operation's bringing back memories of his life-saving liver transplant.
That was when he first stood up, that wasn't it?
Yeah.
When he got his strength to stand up.
Yeah. Seems like a lifetime ago.
It does.
Looking at pictures, it don't feel like he was even there. To be told at 1-year-old, you don't know whether he's going to pull through or not. So then looking at him now, just getting his... still brings it all back.
If somebody saw him that didn't know him, you wouldn't even know that he's been through what he's been through. But he's done well. He's a fighter.
After 90 minutes in surgery, Ruben's operation is over and he can be reunited with his parents.
I didn't think he'd be asleep though. I've never seen him asleep in recovery. So, but he'd be tired out, bless him.
It's not long before he begins to stir.
I'll go that side, then he can see. Oh, Ruben!
Okay.
You alright?
You okay?
Alright, baby.
Charlie's coming anyway, so forget it's a bit.
Leaving surgical bed 4 behind, Ruben can now rejoin Pediatric bed 3 to recuperate.
Okay. Yeah, I'm going to get you something to eat now.
Get you a drink first.
Need a wee wee anything?
I'm going to have Mickey Mouse.
Hello.
3 hours after surgery, Ruben's up and about.
Yeah, that's fine. Thank you.
And it's time to go.
Thank you. Bye. See you later. Bye. Yay, bye. Very good day, haven't you? Very brave. Nice set of teeth now.
I'll get you a mirror now so you can have a look at your nice new white teeth.
It's a lot better to be just in front here.
In and out, that's what we like, isn't it?
As Ruben and his family leave, Pediatric bed 3 can be cleaned and prepped, ready for its next patient. Back at Barnsley Hospital on resus bed 2, doctors are getting ready to reset 16-year-old Lewis's dislocated elbow. Dad Brian is by his side.
Well, you just relax. Relax, 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 relax.
It's a tricky procedure. Dr. Humphrey needs to give footballer Lewis a strong sedative.
Attend your playing for Leeds at Ellen Road. It's the quarter-final of the FA Cup. Just open your eyes for us. Relax your arm.
There's a risk of serious damage being caused during the manipulation if doctors don't get it right.
You have to be careful about any potential nerves and blood vessels around the joint, because if you overstretch those, then that can cause damage later on.
Within minutes, Dr. Humphrey's skilled hand puts Lewis's elbow back into place.
All done. Yeah, yeah.
Do the nap yourself.
Basically, what he's had is a drug called ketamine. It's most well known for being an anaesthetic that vets use. The lights will be on, but there'll be no one at home.
Does it feel a bit weird?
But what we like to do is let them wake up without too much stimulation. Otherwise, they can become quite agitated, because it's very disorientating having ketamine.
Oh my. Oh, did it look horrible when you put it back in?
No, it's just...
Yeah, just move it. Yeah, you can move it.
You back in the land of the living?
Sort of.
Right, let's disconnect you from all of this and get you around for an X-ray, shall we?
After 20 minutes on resus bed 2, Lewis needs a second X-ray. It will be crucial for his footballing career that there's been no lasting damage.
At least he can move it now and get in the position they want, as before he was in a lot of pain. Must be good stuff they give him. Good little in and out job.
Lewis has important football trials for Premiership clubs lined up for the month ahead.
Feels a bit better. It's still sore when I move it, but so you can recover quick.
The X-rays show that Lewis's elbow is back in place, but there is some ligament damage.
Okay, it's back in, but you'll just feel a bit stiff, all right? And you can see that your elbow is a little bit more swollen probably than the other one.
Yeah.
Yeah, okay. So you're going to have a little bit of swelling around there. Any questions?
No.
Sure?
That's fine.
Yeah, okay. When were you supposed to have another trial then? It's half term.
It's March.
March.
They're always coming up.
Yeah. If he was my son, I think I'd be looking at least a month without playing. School's fine, yeah, don't worry, you know. Sorry about that.
Hope to get back to it as soon as possible.
At least he's not going to stop his football. I don't know. Kids say.
Lewis is discharged. Resus bed 2 is prepped ready for its next patient. The Queen Elizabeth Hospital, Birmingham.
Are you feeling yourself any pain?
Here, the 81 beds in the day surgery unit work a 12-hour shift.
So there's not enough beds at the moment, but it all works out.
They're often on the move, taking patients to and from the hospital's many operating theatres.
Excusez-moi, s'il vous plaît. Thank you.
Day surgery bed 32 is prepped and ready for its next patient.
We shouldn't be too long now. What time is it? It's 10 to 12.
Former builder, 78-year-old Pat, has come in with his wife of 55 years, Dolly. He's here to have a dialysis line removed from his chest.
Patrick, Fitzpatrick.
I look at you. Hold on a minute, mate. Like it in handbag.
Pat's been on kidney dialysis for the last 4 months due to a serious infection.
Take a seat there, Patrick.
This will mark the end of a tough journey to recovery.
You'll have to get your gown and all on.
What are we having done today, Patrick?
I'm having a line taken out.
Taken out. Lovely.
Nurse Davies is looking after Pat today.
What are you, a mere nurse?
That's what they tell me.
Well, that's good enough for me.
Pat and Dolly met at a dance 58 years ago.
We met in the Shamrock in Birmingham. I asked her for a dance and she said she would.
You've just got to get up and get going and try and make the best of what you've got. That's always been our motto. Just get on with it. That's what life is all about.
I had him waltzing around the table on Sunday afternoon.
With this girl beside you, you had no choice.
He was in dialysis from the end of October until the second 2 weeks in January.
Pat's treatment is now complete. But just 3 months ago, it was touch and go whether he would survive.
One of the evenings he took poorly and they sent for the paramedics. For the whole lot of us, it was devastating because we thought, will he come out of this at all? Now, sit back now. That better? Or not? Our son came in and gave him what's classed in the Catholic Church as the last rites. Are you okay, Pet?
Yeah.
That's good.
Okay, sir. I'll see you in a little while, sir.
Okay.
Okay then.
It's time for day surgery bed 32 to take Pat to theatre.
Watch your toe, darling.
Okay, love. See you later. Good luck.
See you later, darling.
Surgeons will soon remove the line in his chest, marking the end of his kidney dialysis.
So you've been here before then?
Yes, I had a treble bypass. Best thing ever had.
That's a bit.
Later, we rejoin day surgery bed 32 to find out how Pat gets on in theatre.
Almost there.
Back at Leicester's Royal Infirmary, on maternity bed 5, it's more than 20 hours since 41-year-old Gillian was induced. Husband Matt is with her.
Just like things to move on, wouldn't I?
As long as you and baby are healthy, then that's fine.
With her first child, Gillian needed an emergency caesarean. This time, she wants to have a natural birth.
We were asked to stay active and stay mobile. So walked up and down like a demented zombie till about 4:10, when the very kind midwife said perhaps I should have some sleep.
But doctors have decided the induction isn't working. For the safety of Gillian and her unborn baby, she'll have to have a caesarean section. Midwife Constance has had to break the news.
You're right. Yeah. Not unexpected, but still gutting, isn't it? Still gutting. Okay. All right. Well, I'll give you a bit of time alone. You can pop obviously your trousers and everything back on. All right, take that. It's a sunny day and it's gonna be fine.
You did the best you could. Honestly, you did the best you could.
She is upset about it, as all women are when they end up having to have caesarean sections because it's surgery. So she's upset because I think she felt that she wanted to do it on her own.
You on the bed?
The time has come for Gillian and maternity bed 5 to head to surgery.
So this is the theatre, Gillian. The rest of the team are waiting for you. Gillian, everybody.
I'm a bit nervous.
Maternity bed 5 has handed Gillian over to the operating table. We'll be back later to find out whether Gillian's caesarean section goes according to plan. Back at Birmingham's Queen Elizabeth Hospital, day surgery bed 32 is taking former builder Pat to theatre.
That's what they call me.
He's had 4 months of gruelling kidney dialysis. Today, the line he had fitted for treatment is being removed from his chest.
I'm going to be doing a procedure for you today. I need to make a small incision just on the surface of the skin here, and that will allow me to free this cuff that you've got under the line. Right. So this is the sharp bit.
Pat's wife and dancing partner of 55 years is waiting outside.
So we're very pleased now today that the line is coming out, and that's the end of the dialysis. So that we still got a few dance years, we hope, left in us. Quite a few.
Breathe in, breathe out. Good.
In less than 15 minutes, the line is successfully removed.
All done.
Good lad. Thank you very much. That was very good. Didn't feel a thing.
Pat and day surgery bed 32 head back to the ward to be reunited with wife Dolly.
All right, dear. How you doing, mate? All right. Thank you very much.
How are you, love?
I'm all right, dear.
Nice to see you back. Are you okay, Pet?
Yeah.
That's good. Are you hungry?
No.
Now, how do you feel now that you don't have to have that line in again and that the
I
dialysis
feel
is
absolutely
finished?
wonderful.
That is brilliant, isn't it?
That is wonderful.
Life is going to be the same as it was beforehand, I hope. We're still as upbeat as we were before all of this started. Look here, keep this covered up. Put your hand back a bit, that's it. The future's looking very rosy. And as long as we can do a slow waltz or an old-time waltz, we're quite happy with that. You're on the right road now. That's another one over. That's another one ticked off. And then when you feel better in yourself, then we'll be able to go dancing, yeah? You're not getting away with that now, look. Don't think you are. Don't think you are. So the first old-time waltz that comes on anywhere we're going, you're definitely, you've been asked now and it's a lady's choice, so you can't refuse. Because if you do, you won't get asked again.
I will have to refuse you.
Yeah, you won't get asked again.
90 minutes later, and just 4 hours after checking onto the day surgery ward, Patrick and bed 32 part company.
Okay, that's good.
See you in a little while, sir.
Yes, that's fine. Thank you very much.
Very
Thank
well.
you, Andy. Thank you. Thank you.
Pat and Dolly head home, but there's just time to practice that waltz before they go.
That floor was good, to be quite honest. You see, now that's better than you were on Sunday last. See? It's better than you were on Sunday.
There's room for more improvement.
Not an awful lot, but a little. All right.
Anyway, thanks very much.
All right, thank you.
Back at Leicester's Royal Infirmary, maternity bed 5 is all alone. Mum-to-be Gillian has been taken to the operating theatre and is having an epidural.
If you do feel something that's sharp, try your best to keep as still as you can.
Gillian wanted a natural birth, but after a failed induction, doctors said she needed a caesarean section.
Is that too tight?
No, that's fine.
Husband Matt has been by his wife's side throughout.
Hello, welcome. How you doing?
It's been a bit emotional. It's a funny thing losing your baby bump. It's I suppose it's just transitioning into a whole new phase, isn't it?
New phase in the journey
It
of
is a
life.
bit weird losing this beautiful connection with this baby who's been growing inside you. Mostly I'm happy, I feel safe, I feel great. Yeah, nothing to worry about.
I'm looking forward to this. I'm not going to peek over that curtain.
You're not? No, you're not.
Somebody will be dragging me out and be on the floor.
Keep looking at me.
I'm okay now. I'm fine.
Sure?
Yeah.
More than a quarter of all babies born in the UK are delivered by caesarean section. After just 7 minutes in theatre, baby Rory is brought into the world.
Yeah, well done.
Thank you.
I feel like I won the lottery. Great.
Finally, Mum Gillian gets to hold her newborn baby Rory.
It says it's a bit cold. Both these hats are too small.
Well, I've got lots more on my back.
Well, worth it, Jeff.
So happy. So safe. Feel you safe. It's just perfect. It's perfect.
Gillian will be reunited with maternity bed 5 to be taken to a ward. She'll spend a couple of days recovering from her surgery before heading home. Our hospital beds have given us intimate access to the work of the NHS. Lewis's elbow has repaired fully. He's back on the football pitch and attending club trials. Pat and Dolly are back at home and dancing whenever they get the chance. After a series of tests, Charles was diagnosed with terminal leukemia. He's still caring for wife Wendy at home. The beds are now back on their wards, ready and waiting for their next round of patients.